Health. September is Sickle Cell Awareness Month, and the disease is the most common inherited blood disorder in the United States. We wanted to learn more about it, so we're joined now by Dr. Tiffany Lucas from Kaiser. Thank you for being here.
Thanks for having me.
So it's inherited. It's just something that your parents passed down to you?
Yeah, unfortunately, patients that have sickle cell disease inherit a changed copy of their hemoglobin from their mother and then a changed copy from their father. And that can lead to the manifestations of this chronic health condition. You're born with it, and then you have to live your life and all the medical complications that come with it.
Do you know when you're born with it? Do the parents know that the baby's born with it, or is it something that the symptoms develop over time?
We're very fortunate to live in the United States. In the United States, we have something called newborn screening program. So all babies, when they're born in the hospital, get tested for a number of more rare conditions than sickle cell disease, but inclusive of sickle cell disease. And you would get notified very shortly after the child's birth that they had it. And then we'd be able to start life-saving treatment very soon thereafter. Most of the times, me as a hematologist will be calling these patients within the first 2 weeks of life to let them know about the diagnosis and what steps we would take ahead.
And so what are the symptoms?
Most patients don't have symptoms when they're first born, which is great. But they are, as they develop over time, because sickle cell is a disease of the blood cells that carry oxygen to the body can change in shape with sickle cell, and that can cause pain, especially in the arms and legs and extremities. On the other end of the spectrum, it can also cause strokes or changes in the heart and lungs and kidneys. So these are all things that we monitor for. This is why newborn screening is so important, because we find these patients early and are able to monitor them throughout their lifetime.
And starting treatment earlier probably helps too.
Yeah, fortunately in the United States, we have a medication that's approved, that was approved in 2017 for use to prevent some of the complications of sickle cell. And even more fortunately, research has advanced us to the point that as of last year in 2024, there are options for gene therapy to change the genes that are in your body that originally cause you to have sickle cell and potentially put you in a place where your body no longer produces the abnormal cells.
And with Awareness Month for this disease right now, is it that you want to get people to know more that they can get tested, or that there are treatments out there, that they're not alone if this happens to them or their family?
Yeah, I think there are three things. The most important is that if you do have the diagnosis, that you're not alone. That community feel, not only with the doctors and the whole team that takes care of you, but also to make sure that you know that you're not the only patient in the country. We have about 1,000 births of patients with sickle cell in the United States every year. So you are in good company that facing this chronic disorder. The second thing is also many of these patients will need transfusions, blood transfusions, in order to move along and keep their health in check. So blood transfusions are something that are really important to us during this month. So talking about how you can donate blood if you don't have sickle cell is really important to us. And there are a number of blood drives that have happened, including one here at Kaiser earlier this month.
Well, we're so glad you could join us, Dr. Tiffany Lucas, to talk about Sickle Cell Awareness Month. Appreciate your time.
Yeah, thanks for having me.